Hi, my name is Mailam and I'm going to talk about immunotherapy in renal cell carcinoma and Ribavirin for chronic hepatitis E virus infections in transplant recipients. Renal cell carcinoma is the third type of urologic cancer and has a poor prognosis with 30% of the metastatic patients seek diagnosis. New strategies are emerging to improve the efficacy, and the emerging drugs are under evaluation in ongoing trials. With the different treatment options, there is an urgent need to identify biomarkers in order to predict the efficacy of drugs and to better stratify patients.
Sunitinib is a standard first-line treatment for kidney cancer, but it's becoming decreasingly used in the first line. For these intermediate and high-risk patients right now, it's probably not the standard of care. The standard of care at Columbia and at other places, actually especially academic places, is combination immunotherapy with anti-PD-1 and anti-CTLA-4. So whether you'd get the same result with modern immunotherapy or not is a very good question.
Applications in medicine. About 9 out of every 10 kidney cancers are renal cell carcinomas, cancers that form in the lining of the tubules inside the kidney. About 7 out of 10 people with renal cell carcinoma has a subtype called clear cell carcinoma. In its early stages, kidney cancer typically has no symptoms. As a tumor grows, symptoms may include blood in the urine, pain or a lump in the lower back of the abdomen, fatigue, weight loss, and swelling in the ankles or legs.
Checkpoint inhibition, that is actually a form of immunotherapy. So that whole class of therapy, what it essentially does is ramps up your own immune system and releases the brakes that the tumor created to slow down your immune system from fighting your own cancer. It lets go of the brakes so that you can fight the cancer yourself. And when it works, it is actually astounding. It's really quite remarkable. It doesn't work for everybody, but when it works, it's really quite remarkable. Well, interestingly, checkpoint inhibition, again, this immunotherapy approach, that has exploded on the scene for bladder cancer as well. And that is rapidly changing the paradigm for the management of advanced bladder cancer. And so there's active trials ongoing right now trying to figure out exactly what space that therapy should fit in. Should it just be in metastatic disease, or does it have a role in locally advanced disease, or even earlier stages? So that is probably the single biggest advance in the last couple of years, and it's just taking bladder cancer by storm.
Pros and cons. Pros: high accuracy, specificity, and targeting of the immunotherapy. Immunotherapy is effective for a long time. Wide adaptability. The treatment can control and kill multiple types of tumors. The cons: the use of immunocheckpoint inhibitors can produce negative regulations leading to autoimmune diseases and even death. The effect of immunotherapy is affected by many factors. The survival rate and prognosis of patients are uncertain. Treatment costs are high.
Immunotherapy has offered hope for curing cancer for over 100 years now, but now it is delivering on this promise, and the reason behind that is new strategy, and that is immunotherapy. Immunotherapy is a new tool to fight cancer. How does immunotherapy work? It activates body's own immune system to fight cancer. At Max Cancer Center, we are dedicated to the research in different fields, and we have treated over 200 patients with immunotherapy. And immunotherapy has role is especially in the lung cancer. And now, with the advent of immunotherapy, with the advent of immuno-oncology, we see more and more patients survive longer. Immunotherapy works only in 40 to 60% of patients. It does not work for everybody. At Max Institute of Cancer Care, Shalimar Bagh, we are looking at different approaches how to augment the effect of this immunotherapy. And so far what we have tried, we have combined immunotherapy and radiation therapy, and we have seen good results.
Issue applied in Ecuador. Renal cancer constitutes 2 or 3 of all malignant pathologies. Of these, clear cell renal carcinoma corresponds to approximately 80% due to the fact that this histopathological type is resistant to chemotherapy. New molecules are used for treatment worldwide called target therapy, with significant results of rejection-free survival.
Number 4. Advances in immunotherapy for cancer treatment.
Using the body's own immune system to fight cancer isn't something new, but its advancement towards a cure for cancer is. The market for immunotherapeutic cancer therapies has seen an unprecedented number of FDA approvals. One of the most notable advancements is joint therapy, the integration of immunotherapy and chemotherapy. In a sample of patients with metastatic, non-squamous, non-small cell lung cancer, joint therapy has been incredibly effective, more than doubling the cancer response rate from its rate with chemotherapy alone. Other innovations on the immunotherapy front involve therapies derived from T cells. New forms of engineered T cells have exhibited enhanced anti-tumor activity targeting antigens on tumor cells, allowing the body's immune defenses to attack the cancers within a patient. The agent with the most promise in 2019 is that of a T-cell receptor, TCR, T-cell therapy developed for use in liver cancer, the world's third most deadly. With a near-daily discovery of new immunotherapeutic targets, it is the hope that effective therapies will soon exist for all tumor profiles.
Conclusion. Cancer immunotherapy is an innovative treatment for tumors today. In various experiments and clinical studies, it has been found that immunotherapy renal cell carcinoma is a kidney cancer that originates in the lining of the proximal convoluted tubule, a part of the very small tubes in the kidney that transports primary urine.
Savoir is a randomized phase 3 trial comparing the pure MET inhibitor savolitinib versus standard of care VEGF tyrosine kinase inhibitor sunitinib, specifically in advanced papillary renal cell cancer that harbor MET alteration. 30 to 40% of papillary renal cell cancer can have MET alteration. So in this study, we randomized patient to either sunitinib standard of care or savolitinib. Unfortunately, the trial had to be halted after 60 patients out of 180 that were supposed to be on, due to the fact that another epidemiological study showed that patients treated with sunitinib do not have a short progression-free survival when they have MET alteration. But nevertheless, Savoir showed that savolitinib is well tolerated with less treatment dose reduction or adverse event than sunitinib. And despite the small number, it showed that savolitinib numerically has higher response rate, progression-free survival, and even overall survival. The overall survival hazard ratio was 0.51 compared to sunitinib. So this, was quite encouraging, and we will continue to evaluate savolitinib in papillary RCC, hopefully with another study.
Now, I'm going to talk about Ribavirin for chronic hepatitis E virus infections in transplant recipients. First, the definition. Hepatitis E virus is an icosahedral non-enveloped single-stranded RNA virus that is approximately 27 to 34 nm in diameter. It has been classified as a single member of the genus Herpesvirus in the family of Ribaviridae. The antiviral drug Ribavirin can clear chronic hepatitis E virus in a solid organ transplant recipient, researchers reported.
Hepatitis E is RNA virus. Spread by the fecal-oral route. Incubation period 3 to 8 weeks. Common in Central and Southeast Asia, North and West Africa, and in Mexico. Causes a similar disease to hepatitis A, but carries a significant mortality, about 20% during pregnancy. In general, hepatitis E is a self-limiting viral infection followed by recovery. Prolonged viremia or fecal shedding are unusual. In acute infection, IgM antibodies to hepatitis E virus are positive. Does not usually cause chronic disease. A vaccine is currently in development, but is not yet in widespread use. Thank you for watching.
Issue applied in Ecuador. HIV infection is usually self-limited except in patients with suppressed immune system, where it can evolve to chronic hepatitis and cirrhosis.
Our lab studies hepatitis B and E viruses, which cause about 300 million infections worldwide and kill almost 1 million people annually. Neither one has a cure. We have developed new screening systems to identify new drugs to cure these viruses. Both hepatitis B and E viruses affect the liver, but they are very different viruses. Hepatitis B virus is transmitted through the blood and other bodily fluids. It enters liver cells where it hides in the nucleus. We try to find drugs that can kill this virus without causing harm to the patient. Hepatitis E virus infects people through contaminated pork meat and water. It stays within the cell body. We try to find molecules that can stop the virus from making copies of.
Pros and cons. Pros. Ribavirin is a general antiviral that inhibits replications of many RNA and DNA viruses. It has long been used to treat hepatitis C, along with pegylated interferon alpha and now several direct-acting 18 HCV agents. The cons. Ribavirin is a safe treatment option for HIV infections. However, the optimal dose of Ribavirin for the treatment of chronic hepatitis C remains to be determined as a treatment failure may occur. Issue applied in Ecuador. In Ecuador, Ribavirin is a synthetic nucleoside analog that has shown in vitro activity against certain RNA and DNA viruses. The mechanism by which Ribavirin, in combination with other medicinal products, exerts its effects against HCV is unknown.
Hepatitis is a very general term. People will get diagnosed with hepatitis And what I try to do in clinic is to educate them about the different forms of hepatitis. All hepatitis really means is inflammation of your liver. What we try to do is figure out what is causing that inflammation. And there are a lot of different explanations for that. So we try to pinpoint what it is that is causing that inflammation.
Conclusions. There is no established therapy for the hepatitis E virus infection. The aim of the retrospective multicenter case series was to assess the effects of Ribavirin as a monotherapy for solid organ transplant recipients with prolonged HIV viremia. Thank you.